Welcome back to Living 808. For most of us, driving is a big part of our daily life. But when life changes happen, they may affect our ability to operate a car safely. And that's when it's important to assess and possibly reinforce our driving skills. Joining us today to talk more about driving readiness, Whitney Ray Asal from Rehabilitation Hospital of the Pacific. Hello, thank you so much for joining us.
Thank you for having us.
So you guys have a rehab drivers program. Tell us about that.
Correct. So Rehab Drivers Program is a comprehensive assessment of a person's readiness to return to driving. At Rehabilitation Hospital of the Pacific, our main goal is to rebuild lives and to help our patients gain their independence. And in doing so, our drivers program is perfectly aligned to help with this mission.
Okay, and so what does the program involve?
So the program involves 3 parts. The first part is done in the clinic. And in the clinic, we're going to look at their cognition, their vision, their reaction time, their physical abilities, so whether or not they can turn the wheel completely, if they can get their foot on the accelerator and then onto the brake. If that goes as planned, then we're going to move on to step 2. And step 2 involves a behind-the-wheel assessment. While they're in the car, they're going to be using our Rehab Drivers Program vehicle. It's equipped with a passenger side brake and gas for safety. And then we're going to see how they're actually operating a vehicle. Sometimes if it's needed, we're also going to do what we call an adaptive fitting and training. So that's going to include fitting them for any adaptive equipment that's needed after maybe some injury or a disability. For example, after a stroke sometimes, someone who is no longer able to use the right side of their body, we can fit them to use a left foot accelerator to operate the vehicle in a different way.
Wow. So who should participate in this program?
So we can see a wide range of people in our drivers program. Anybody who has had an illness or an injury can definitely come through our program, but we also see a lot of seniors that come through our program, and actually more recently we've been having a lot of adults who are recommending that their parents or their grandparents get formally evaluated. They're concerned about their parents or their grandparents being on the road, and they just want a formal assessment to help their families basically to feel more comfortable allowing their parent or their grandparent to continue driving.
Yeah, this is wonderful. This sounds like a wonderful program. And I think, you know, when you first told me about the program, I immediately thought of seniors. And sometimes, you know, they've been driving their whole lives. It's very hard for them to give up that you know, give up driving, right? They've been doing it, they're comfortable doing it, and they may not recognize the signs that maybe they shouldn't be driving anymore. So this is a good, it's a win-win, you know. It evaluates their driving ability, but it could also make their family members feel more comfortable. Right? If they passed all the tests with flying colors.
Right, exactly. Yeah. And our main goal is to keep them on the road for as long as possible. So whether it involves us making a recommendation so that they can continue driving, but in a more safe manner, that's definitely the main goal. We don't want to take away their independence or their license unless it's very necessary.
So what are some of the other benefits of driving, this driving program, and in particular for seniors?
So for seniors, we're going to be assessing any impacts of aging. So as we age, our reaction time tends to slow. So we're going to be looking at that. How fast can they react from getting their foot from the accelerator to the brake? We're going to be using our driving simulator to do that. We also check their eye-hand coordination, their ability to dual task, so whether or not they can pay attention to more than one thing at a time from now on. Also their memory, so if they do start out on the road, are they going to remember where they're going? If they start out from point A, are they going to remember where they're going to point B? And sometimes there's construction on the road, so sometimes their pathways are going to have to change from their typical driving routes. So we're going to be able to monitor for those things and those changes to determine whether or not they're going to still be safe.
It sounds like everyone should go through this driving program. I'm listening to you going, I should do that. We're almost out of time, but how does this program fit with the other patient services that Rehab provides?
Our main goal at Rehab is to get people out in the community again as safely as possible, and that's exactly what our main goal is at our drivers program. We really want to keep them as independent and as safe as possible on that road.
All right, Whitney, thank you so much. If you are interested in this program, we're going to have all of the information on our website, right? We've got your phone number and your website, rehabhospital.org. Thank you so much for joining us. This is a wonderful service. I hope everybody takes advantage of it.